Hello and welcome to SHRP Talk, the show by washed up athletes for washed up athletes looking to be their best self. On today's episode, the brothers and I sat down with Dr. Julia Iafrate. Julia and Brandon were both at the University of Iowa at the same time, so that's where they got connected. She currently serves in New York as a specialist in sports medicine. She's a double board certified doctor in sports medicine and physical medicine and rehab. She works with dancers, former college and professional athletes, to youth athletes, to those who are elderly. So she's a jack of all trades. She's also a member of the rotating team of physicians for the U.S. Olympic ski team and serves as a medical director for the Fordham Preparatory School. We dive into her upbringing, growing up in Canada and moving around different parts of the U.S. and even living in Kenya for a little bit. We talk about her unique sports background and some knee injuries that she dealt with, which ultimately led to her getting passionate about sports medicine and some steps in the journey, including the University of Iowa, as well as some other stops in the way. We dive into some different modalities that she uses with her clients and her day-to-day role, what that looks like, as well as some cool things she has going on research-wise and even outside of her current role. So it was great talking to her. She has a wealth of knowledge in all areas of sports medicine and rehab, and I'm sure there'll be many takeaways for current and former athletes alike. So thanks for tuning in, and hopefully you enjoy. Before we get rolling with today's episode, I want to take a minute to tell you about SHRP Training. Snyder Health, Recovery, and Performance Training is designed for former college athletes to improve their physical, mental, and spiritual health. For only $12 a month, you can choose a training plan that is catered to your needs, interests, and goals, with new programs delivered each month through the TeamBuilder app. You'll also receive 24/7 messaging and feedback from coaches, access to an exclusive Discord to continually learn and be encouraged by others, a 20% discount on Thorne supplements, and access to the Sharp Edge, the ultimate guide to upgrading your diet, sleep, and life. Iron sharpens iron, so let us help you become your sharpest self. Now let's go.
The Dr. J, excited to have you on. I'll let you kind of dive into all of the things that you've done, all the different stops, how educated you are, and how much more you know than all of us. No, we're excited to learn from you, to talk with you. I think you have a great perspective. I think you have a lot to teach us and our listeners. And I know that you meant a lot to me at a time in Iowa when I really needed it. Gave me almost like a breath outside of the facility, a different perspective, and allowed me to find just some more enjoyment in what I was doing at the time. And I don't know if, we've never really talked about that, but it was almost kind of the beginning of a really tough journey for me at that time. And so it was good then, during that season, but it got much tougher afterwards. And so I know as much as you helped me on the, with the quad contusion and the ultrasound, it was a lot more than that. So we're excited to have you on. Thanks for joining us. Ready to go and learn. So
I appreciate you. And I'm very excited to be here. So just very briefly about myself. My name's Julia Iafrate. It is an I, not an L. It's a difficult last name. It's Italian. It's Iafrate, but that's so hard for people. So that is why I go by Dr. J in most of my activities outside of my regular medical practice. But I am Canadian. I was born and raised in just outside of Niagara Falls, and then moved to the U.S. for medical school after moving to Kenya, actually, initially. I lived in Kenya for a couple of months while I was deciding if I wanted to do medicine. Initially, I had been on track to become an athletic trainer because I loved being on the field, and I myself had 3 knee surgeries during my college career. So I played soccer, I downhill slalom skied, and I danced competitively. And so my first surgery was in my what you call freshman year, or my first year of undergrad. And it kind of just went downhill from there. And I realized I was not going to be a competitive skier or dancer anymore because my knees just weren't living up to what I was expecting out of them. And so it got me interested in medicine and rehab and sports and how to find like that mesh of all of them. And so after looking into athletic training, I realized I was going to hit a glass ceiling pretty quickly. And Brandon knows me pretty well. You guys don't know me, but you will find probably pretty quickly that I don't do well with authority. I don't like being told what to do. And so I thought as an athletic trainer, I thought it would be really cool because I'd get to be on the field, but I also felt like I wouldn't have the end say, and I didn't love that for me. And so that's why I started thinking about medicine, because nobody in my family is involved in medicine whatsoever. Everyone's business, teachers, whatever. And so to my family's confusion and perhaps a little bit of a chagrin, I looked at medical school in the US as well as Canada, and then ended up deciding to go to medical school in the US. So I moved to Arizona from Canada.
Oh my goodness.
Yeah, that was a big move. I interviewed there in February, so
Yeah.
in my defense, it was lovely.
Uh-huh.
But then once the summer hit, I was like, oh, now I get it. Now I know why it's so hot here. So I ended up, after my first 2 years at Midwestern University's campus down in Arizona, I actually switched and moved up to Columbus, Ohio, and did my second 2 years, so my clinical years of medical school at Doctors Hospital in Ohio State, and kind of with this Columbus, Ohio kind of group. And from there, ended up doing my intern year in Indianapolis. I did my residency at the Mayo Clinic in Minnesota, and then came down to Iowa for my sports medicine fellowship, which is where I met Brandon, and got to work with my favorite team of all time.
That's right.
The Iowa Hawkeyes. Yeah. So it was so fun. It was, I moved a lot, but I wasn't from the States, so I was trying to figure out where I liked, where I wanted to live, and it was kind of a cool way to see a lot of this country.
That's awesome. Can you dive into what you're doing currently, and then we can unpack
Absolutely.
some of the stuff in your past?
Yeah. So right after my fellowship, I was recruited to a hospital in New York, and Columbia, and I was there for 4 years, and then ended up leaving there kind of right after the pandemic. So I during the pandemic, I volunteered in the ICU. I almost got deported, which if you guys want to talk about that, we can talk about that, I guess. And during that time, I was trying to figure out, what do I really want to do? What matters the most to me? So, as a sports medicine doctor, I love team coverage, but in New York, it's very different because you're traveling really far to get to some of these teams. And I really love the college kind of group. I enjoy professional sports, which is why, I cover the Olympic ski team as well. But I really love college ball. I think that's where I have the most fun. And so I switched over to NYU orthopedics. And so now I work at NYU Langone Health in the Department of Orthopedics in the Division of Sports Medicine. And I take care of some of the college athletes there. I also take care of a number of professional dancers in New York and the U.S. ski team. And then I do help out. I was the team doctor for Gotham, the National Women's Soccer League, Gotham FC. But I left about 1.5 years ago when I had my baby, because it was just a little bit hard to try to be on the pitch when you're 9 months pregnant. So eventually I'll get back there, but right now I'm trying to spend my evenings and my weekends with my child, as opposed to covering teams in the terrible weather or something outside.
Yeah.
Sure. I'd love to hear more about your athletic background. I mean, for most of our listeners, I don't want to speak for them, but they probably have a similar background as us, like maybe multi-sport athletes, football, basketball, baseball, but you have 3 sports that are quite unique, and I'd love to hear more about that.
They don't go together, do they?
Yeah. And maybe also, if you're willing, dive into those knee injuries and maybe what you think caused those and what those were.
Yeah. So growing up in Canada, I think skiing just kind of was par for the course. My dad actually was a very high level hockey player. And my dad's cousin is Al Iafrate, who was, if you know hockey at all, he had the fastest slap shot in the league during the 90s, and he had a sweet mullet to go with it. And that's the only people that know how to say my last name is him, fans of him. But anyways, so my dad played hockey too, and he very quickly kind of decided, like, either we're going to play hockey or we're going to do some other winter sport. And, you know, I being the oldest out of the 3 kids kind of picked. And as much as I liked hockey, I think it made my mom very nervous, skating. And skiing was just like a fun thing that we could do as a family. My mom could, you know, come skiing too and stuff like that. So we ended up skiing. I got very good very early on. I used to race. And it was just something that was just joy. It was like winter joy for me, I guess, for lack of a better term. And I didn't start. I started playing soccer around the same time, actually. And the only reason I started playing soccer is because my uncle was in charge of like the Pelham Soccer League in the town that I grew up in. And he kind of made me do it because I was big into dance. Like all I wanted to do was dance. I started dancing at 2 years old, like a little tap dancing prodigy kind of thing. And so soccer kind of got like forced on me, but became a love because again, I ended up, you know, playing center midfield. I got to run the field a little bit. I was like, you know, Andrea Pirlo of my team. And that worked for me. It was somewhere where I could be loud and bossy and really try to understand the field. And I never got to play at the level where I maybe hoped I would, but it was something that just continued to perpetuate my love of sports and of strength and feeling good in my body and feeling, you know, like I never wanted to be like this skinny girl. I always wanted to be the strong girl. I wanted to be the muscular girl. And so that's kind of pushed me, I think, into a field where sports medicine made sense. And it definitely helped with my knee injuries. You said you wanted to hear about those. So I tore my ACL my very first season in undergrad. And it was a stupid injury. I was dicking around playing badminton. It wasn't even playing.
Oh,
it wasn't even
no.
playing against sport. It was just like it was so dumb. And I like I always was like I shouldn't tell people I did it like this, but that's how it happened, you know. And I had a great surgeon, Dr. Stewart, out at McMaster University, which is in Canada, where I went to undergrad. It's in Hamilton. And I remember the first thing I asked him was like, can I stay awake for the surgery? Can I watch it? And he's like, no, you can't. And I was like, okay, but can you take like a lot of pictures and videos because I want to see this stuff. And I was always so interested in like how does our body work? I was a kinesiology major. Like I loved the concept of biomechanics and what made my ACL fail, you know? And so after the first injury, it took me like a year of rehab because I couldn't get my range of motion back. And it was really frustrating. And then I had a second injury kind of shortly afterwards, just again, kind of a weird fluke with dance and ended up tearing my meniscus and my plica, which is just like this extra tissue that some people have in their knee. Not everyone has one, but and so that was an easy surgery and that wasn't too bad. But I spent a lot of time with my athletic trainer and my physical therapist, you know, more than I was on the field at that point. And so I started getting really interested in like the rehab aspect of like, how do we get back to the sports we love? How do we get back to function, right? Function's like what matters. Like as we age, you know, aging athletes, the only thing that's important is, are you functional, right? I don't care if you can do, like, I don't care if you can squat 700 pounds anymore. I care if you can run away from the bear, you know, like truthfully, it's not like a 1 rep max doesn't mean anything. And Brendan, I think I talked to you about this. 1 reps, like those things don't actually matter. They're cool for like getting a pat on the back here and there, but they're not useful to your actual everyday life. And so it's about what makes you a better, stronger individual person and what's going to keep you healthy for the longest point in time in your life. And then my third injury, I actually fractured my tibia, which was kind of stupid. But it really just like solidified, like you're not playing sports anymore. Like like I still play sports, but you're not competing anymore. So, you know, my ski, aggressive ski dreams kind of like calmed down a little bit, and I still danced for a long time. I still danced competitively. But it changed. I moved more into the hip hop and salsa side of things. It was more just, you know, with a dance crew, and it brought me, you know, joy and made me laugh, and was a way it was a creative outlet for me because I was a very science heavy program, and I needed that creativity, that balance, that counterbalance. So that's kind of where my injuries got me to thinking about medicine.
While we're still there with the knee, from your knowledge and studies and through the process post ACL, is there did you find anything that you did prior to your ACL that you think played a role in that happening, in just the biomechanics of how our bodies work and that
Yeah.
process?
Yeah. I think part of it was like, so the one thing I was doing right was being a multi-sport athlete, right? So we know that neuromuscular control occurs, as you're going through puberty. And a lot of people that tend to focus on just one sport end up really over defining certain muscle groups and under defining other ones. I'm sure all of you guys, recognize this with your knowledge too. And so the one thing I was doing right was actually being a multi-sport athlete. So I was using multiple muscle groups. I honestly, my first injury was just truly a
Yep.
stupid fluke. It was just one of
Yep.
those like dumb, like I dove for the birdie thinking I was being funny. It was ego
Yeah.
that did
Yeah.
mine, not anything else. Um, but I think part of the rehab journey, what I was realizing is um I think I got a lot weaker really quickly, and I didn't know how to start at that new baseline for my training, and I was trying to train at the level that I was training at previously. And so I didn't take my time kind of building back up. And I think that's where, some of my downfall
Hmm.
was just not giving myself the grace to heal and get back to that point, which, you know, fast forward a million years now after having a kid and going through an emergency C-section, I've had to do the same thing, is retraining my body to
Yeah.
a level of sport that I, was so accustomed to for so long. And my body doesn't know how to do that right now. Not yet.
Mm.
So I'm trying to give myself grace this time. I
Yeah.
learned my lesson. Yeah.
Did dealing with those injuries like build a passion for treating that type of injury going forward, or did that like spark something? I know, like for me, watching Brandon go through his knee injuries,
Yeah.
it kind of like put a fire in me to like do it the right way, like get
Yeah.
athletes back so they only have to go through that process once. I'm curious, like, did that injury process like spark a passion to treat those type of injuries, or what?
Yeah, absolutely. I think understanding why we get injured and what brings it on, and I think the importance of like prehab is so important. And so that's why I really like it when I see athletes kind of before they get really badly injured, because we can look at their biomechanics and try to address things that we know is going to make them more likely to end up with an injury in the future. And I think that's the other reason I really like educating. So I tend to give a lot of lectures, especially in the dance community, because dancers tend to be single sport athletes. And, like it or not, dancers are straight up athletes, artistic athletes, yes, but they are straight up athletes. And so because they're so single sport oriented, because there's so much time that goes into it, the injuries that they end up getting can be very detrimental and basically career ending. And so trying to provide education is so important, and definitely is where I have the most fun with educating my patients. I mean, I love treating problems, absolutely, sure, I'll fix whatever it is that you bring at me, but the education perspective is astronomical, I think, um prior to the injury. Actually, it's like foresight, knowing what's coming before it
Yep.
comes.
Is there any like go-to assessments, or what does that process look like? And maybe it's different for different kinds of athletes, but what's your kind of screening process
Yeah, it's
like with
definitely
that?
different. With our dancers, we have a screen that we have them do with our physical therapist, and some of them are like the airplane test and pencil test, and it's tests to look at like their actual flexibility and range of motion. The other stuff is something as simple as like a running evaluation. Can I see how you or in a jump evaluation? So how do you land from a jump? How do you land in a single leg versus a double leg jump? And looking for that dynamic knee valgus or any like drop in where the knee kind of buckles on itself. And that's because, the connection between the brain telling the muscle what to do isn't fast enough. And so we're not firing those muscles appropriately. I think also understanding that, in order to be truly strong at your sport, you need to have that strong core first. And people think of a core as having the six pack, and that's not the important musculature. It's the stuff deep to that, right? It's the transversalis abs and the external and internal obliques and your glutes. And that includes the the glute max, but also the glute med and min, which are those side butt muscles that stabilize that pelvis every time you're in single leg stance. So I think being able to just, even the second they walk through the door, I'm analyzing how they walk even and looking for those things. One thing I like to tell my patients, and this isn't a knock at supermodels by any means, but like I say, when you see supermodels walking down the catwalk and they've got that like swing to the hips, I was like, that's not sexy. That's just because they're weak. So, educate, like trying to make it fun and funny, but like that way they realize like, oh my God, I do that. How am I going to fix that? I got to work on some of this strengthening. And that's not just like doing clamshells, but it's about dynamic warm-ups and dynamic exercise and doing exercises that involve like multiple compound exercises. So I think that helps to make them understand why I care about this stuff.
Specific to dance, when I worked in Sioux City, we had a dance academy that was a part of like our multiple sports, different areas, and I developed a huge appreciation for the sport, and like it really challenged the way that I saw like human movement, especially like the feet of dancers are unbelievably strong compared to football players who have shoes on all the time and don't use their feet hardly at all, and just super fascinated about that. So I guess one, curious to like the injuries that you see in dancers that are common, a little more common. I'm curious if those are foot related or if they're something else. And then two, also like the strengths of dancers that other athletes could benefit from that we don't, I guess, get the most out of or don't do or could do more of, or something of that nature.
Absolutely. So I think, yes, they do get a ton of foot and ankle injuries. A lot of them tend to occur when they're going through puberty because, like I said, dancers tend to start a lot earlier in their sport and they become, pre-professional very early on because the dancer's career tends to be a little bit shorter and kind of ends usually by the time they're in their mid-20s. But we are definitely seeing dancers that are dancing far past that now. And I think that's just, a nod to good biomechanics. But when you go through a growth spurt, your bones grow faster than your muscles and tendons, right? So bone grows, muscle that holds, or tendon that holds the muscle to the bone, all of a sudden gets stretched really far in one direction, and then the other side gets stretched really far, and it's like they're playing Red Rover and somebody's trying to, come against them. So that will affect their flexibility. And so once the flexibility goes, then they go, well, why am I less flexible all of a sudden? What's going on? And because kids go through puberty at different ages, their friend is still super flexible, but they're all of a sudden not. And so then they start to force things, right? So then we start to compensate. So they will make adjustments to their churn out. For example, I'm going to use ballet as an example, but when their feet go out into the second position, so this is called turnout. And what they'll do is they'll start to like kind of hook their hips and rotate their feet and kind of plant their feet on the floor. And then their knees will roll in and their hips will stick out and they'll get this posterior pelvic tilt, all in an effort to look like they still have good hip range of motion. And so number one, educating and making sure that they understand that it's okay to not have that range of motion right now. You'll get it back. It's just because, you're less flexible for this small moment in time. But they tend to get injuries secondary to those compensatory movements. The other thing, so hip injuries, labral tears, things like that. Certainly injuries to the ankle and knee, sprains a lot of the time. Ankle sprains are so common just because landing from leaps and then obviously being on point at a pretty young age can be pretty detrimental to them. And then FHL tendonitis, so that basically only happens to dancers. There's very few people that get FHL tendonitis, but your flexor hallucis longus is the tendon that comes down and pulls your big toe. I guess this is your big toe on my hand, but you know what I mean? Pulls your big toe down. And so if it scrunches your toe down, it runs right up beside your Achilles. So a lot of people come in saying, I think I hurt my Achilles. It's my Achilles. It's my Achilles. And in their case, it's not. It's usually that FHL because it's going such a long distance to get to that big toe, and it's getting forced into this position where it needs to work, over time. And it's not that big of a tendon, and it's not a very big muscle either. And so they tend to get something called tendonitis, which is acute inflammation of the tendon with maybe some micro tears, which can then perpetuate into tendinosis, which is the more chronic version, right? That's where the collagen type 3 or the crummy collagen that gets laid down in an effort to heal the tissue doesn't convert back into collagen type 1, which is the normal kind of collagen that makes up our tendons, but instead is more like a scar tissue. And so it scars down and then they lose that flexibility. And then the other thing that they can get is something called tenosynovitis, which is inflammation of the actual tendon sheath around the tendon. So the tendon itself might not actually be that bad, but from this constant shearing, they get fluid. It's almost like, imagine injecting fluid into like the casing of a sausage, and now the sausage is getting smushed.
Mm-hmm.
It's a very odd visual for you, but that's exactly what is basically happening.
Yeah.
I'd love to hear about the like strength side. I mean, Brandon hit on a little bit, but like just ways maybe you can get from like dance or even like gymnastics, just ways that, you hit on like the 700-pound squat. I think that's how a lot of us view strength. But I think just looking more at like dance and gymnastics, there's some things they do that are just insane feats of strength.
Yeah.
So maybe just hit on that and
absolutely
what that looks like.
I mean, one good way to realize like how good a lot of dancers' endurance is and how much other athletes maybe falter. I mean, think of like a soccer player or a football player who imagine running out full strength for 2 or 3 minutes straight. Like, who can do that? I can't. You're right? Like, but a dancer will perform full out for a 2 or 3 minute song or dance or whatever, but like segment of time, full out. And so the way they practice versus how they play or how they perform is almost opposite of what most other athletes are, right? So you train in shorter bursts for like more long-term endurance, right? It's like little tiny bursts of energy and then just just you're kind of moving, but there's not a ton happening. Same thing on the soccer pitch, right? No soccer player is running nonstop, full out. Like you're kind of jogging, and then when it's your turn, you do something. With dancers, they practice for a very, very long time to just put out all their energy into this 3-minute session, and then there's nothing. And so I think with that, we see how much better their endurance is and how they have to train to maintain that kind of level of intensity while maintaining that amount of endurance. And so it's a little bit different. And so their big thing is not fatiguing, right? Because that's when you start to lose your biomechanics. And so if when they train, they do the same thing over and over and over and over again, which does increase risk of injury, but it also improves their likelihood of being able to do that short segment of dance really, really well. So I think jumping biomechanics are better in dancers, and I think it's because they work on foot and ankle intrinsic strength so much, and they are so in tune with their bodies that every little minutia of difference in terms of their range of motion is really worked on, and they do a very good job of doing a dynamic warm-up before they work out. Certain college and professional athletes do have really good dynamic warm-ups now. We know that that's so important, but like earlier on that didn't really exist, right? I remember like my warm-ups when I was playing soccer was like, okay, run the field like twice and then like maybe like, I don't know, do some lunges and call it a day. And so I think that getting better at understanding that, I think we're getting a lot of that from the dance literature, the importance of dynamics, but I think balance is so much better in dancers, and I think foot and ankle intrinsic strength is so much better in dancers, and like a good body awareness. And so that is where I think other athletes could pick up a lot from the dance population.
Yeah, that was something I tried to incorporate more. I worked with basketball for a couple of years, and I think there's a lot of foot and ankle weakness, especially with how often they tape or are in like restrictive shoes. So for my warm-ups, as much as I can, just get them barefoot, get them moving around, exploring, just without shoes on. I think that goes a long ways for sure.
Yeah. And I think just like functional movement, right? Like making sure that they have good body awareness, making sure that their flexibility is pretty similar. If there's something that's like constantly like a sticky point for them. Like, how do we work on strengthening you so that you can kind of work through that and compensate appropriately? Because not all of us have perfect biomechanics. That doesn't mean you shouldn't play a sport. It's just figuring out how to do it in a way that's not going to cause you injury down the road.
Yeah, because I mean, it's just like that part, like the foot and ankle for me is like just with my knee injuries, it
Yeah.
just like is fascinating to me. The complexity of like the foot and then like the actual biomechanics. And then like, so we're saying you're trying to just get them barefoot, but then like
Yeah.
that's like so elementary to the actual biomechanics of the foot and
Yeah.
what we're capable of doing as athletes
Yeah.
and what the foot's capable of. I know we've talked about that early in the podcast. Like that world is fascinating to me. I don't know, like, is that something I'm trying to learn now, even as like post athleticism, but
Yeah.
like how do we even educate and begin to understand like the biomechanics of the foot if you're, like if you're a young athlete now? And I mean, I think that's probably something I would spend a ton of time looking into and trying to understand. And
Yeah.
just, I feel like that would open the doors to more athleticism and also like the prehab thing of, handling more strength,
Yeah.
through impact. You
Yeah.
talk about like Jaden, you talk about a lot about like the impact of running even on the foot. And, I don't know. I don't know that we understand the biomechanics as much about the
I
foot
think,
as much as we should.
yeah, I think it's hard. I think the foot's kind of hard to understand. I mean, there's a lot more bones in the foot than any other like joint, right?
Yeah, it's
And there's all these
crazy.
ligaments and tendons that all kind of come into this area. And if one thing's not working, or if some of those bones as you get older, they start to fuse together because of arthritis, how does that change your biomechanics? And I think it is a nod to the fact that there is an entire like subsection of medicine that is geared towards only the foot. I mean, podiatrists
Yeah.
exist
Yeah.
only to look like only for the
Yeah.
foot. Like that's a whole nother type of doctor just for the foot. And then you have your foot and ankle surgeons too. Then you have sports medicine. So like there's three different specialties that are geared towards just one part of our body. And that just goes to show how important it is for us. And I think that in order to keep understanding it, I think looking at the other issue is, I think, shoes, right? So there's an issue between like where fashion and function should coincide, and male or female, you guys, everybody wants to have shoes that are cool or whatever. Like,
Yeah.
you
No
don't
doubt. No doubt.
like there was a
Big shoe
time where
guy.
like the New Balance, like the dad New Balance shoe was very uncool, and now it kind of came back, and now it's like, oh, the dad shoe's kind of cool. Like my husband has a bunch of these, and I'm like, when we were teenagers, we'd laugh at our dad for wearing shoes like that. So luckily things like that kind of come back in full circle, I guess. But at the same time, like looking at finding shoes that actually fit your feet well is really important. Like I had foot surgery a couple of years ago. I had a chelectomy, which is basically I had something called hallux rigidus in my big toe. So I had lost basically the range of motion of that big toe from years of dance and whatever. And I couldn't put my foot into heels anymore because it kept throwing off my biomechanics. So basically I couldn't push through that big toe. And so I was kind of falling over my foot onto the outside, and I was spraining my ankle all the time when I tried to run because I was pushing off kind of crooked. I'm really over exaggerating here. I wasn't, falling into walls or anything, but it was a problem. And so I think understanding that like certain shoes need to fit your foot really well, and finding a shoe that actually works well for you and is a good stability shoe, I think is important. And then I totally agree with Colin on saying like get barefoot sometimes and work on training that foot so that you can actually see what your biomechanics are like without the assistance of the shoe, and then you can decide what shoe should fit you, not the other way around. You don't mold yourself into the shoe. The shoe has to mold itself to you. You got to find the thing that works for you.
I think it's a fine balance, right? It's the shoes that you wear most often, like every single day, that you should prioritize. Like they should be like wide toe box, fit your foot, because that's going to be what you're standing in most of the time. And then you still have the option to wear those heels or whatever shoes you need to when those occasions come. And I think it's just finding the right fit most of the time. I think you hit on a lot of good things with like trunk, like feet. I think things that are commonly overlooked, and just taking a holistic approach to try and find the solution. Everybody's different. Everybody's anatomy is different, but taking the time to do those things that people aren't, get educated on what exercises should I do for my core, for my feet, so that my hips and my knees don't get injured down the road, to try and compensate. I think touching on preventative medicine as well, are there avenues that you find that people are exploring? I know insurance isn't great about paying for stuff that's preventative, right? So it's hard for people to go out on a limb and do stuff when they're feeling fine right now and they don't know what's wrong. But is there ways that people get involved, or ways that you've seen maybe you're going to them and getting involved? I'm curious what strategies there are.
Yeah. So I think, I mean, a lot of us physicians and a lot of like physical therapists and stuff too, will try to educate on, here's what you should be looking for. Here's how you should be, generally speaking, trying to kind of create your best biomechanics so that it decreases your likelihood for getting injured. We at NYU have a run lab that I adore. So in New York, a lot of people run for their physical activity. I mean, that's a very common thing to do. And they all train for the marathon at some point in time in their lives. And, inevitably a lot of people end up getting stress fractures or whatever. And so, one thing I always say is like, I want to have your running gait analyzed, but I want it to be done in a way where we can really pick apart all of your biomechanics. And it's true, like you said, Jada, it's not covered by insurance a lot, which is really frustrating because it is making sure that you stay your healthiest so that we don't have to have you get all these surgeries and whatnot down the road. Like, it's the most ridiculous thing. And yet it is, it is what it is. We're fighting the good fight, but we're going to keep trying. But
that's got to be one of the best things you can do, though, right? Like,
it's
I mean, in my
fabulous.
opinion,
Yes.
That's like, I just like, I would love to do that. I mean, I think that would just be so good for me. Like, have somebody that's knows way more about this, analyze the way I'm walking, running. Like, that sounds like $1 million right there.
Exactly. And I have them, I tell my patients, I was like, I want your normal running gait to be analyzed, not your injured running gait, right? Because there's no reason to analyze something that's not your normal. But we have a group of physical therapists that are literally trained to do this. This is what they do. They do research on it. Like, it is their thing. It is not my thing. It's their thing. And they put little markers on the body. They videotape the person while they're running, and they literally nitpick in the best way possible on where are you weak, where are we faltering, where can we fix this. And I think that is something that people can do. That is so helpful. If you want to do something that's like going to give you some longevity to your biomechanics, that's one thing that's really helpful. I think working with a personal trainer who has an understanding of really important biomechanics, right? Not all personal trainers are created equal, just like all lawyers and doctors and teachers and whatever are. But a personal trainer who really understands like good biomechanics, making sure you're doing things properly. Because my other thing, especially when people start doing a new workout routine, or my answer to when people say, well, can't I just do my own physical therapy instead of going to see a physical therapist? And I make the point that practice makes permanent, not perfect. So if you're doing something wrong and you don't know you're doing it wrong, you're going to keep doing it wrong and put yourself at higher risk for injury than you already were anyways. And so that's why you go to the expert at that thing. So if it's about an injury management and how to heal that injury better so that you can get back to a sport, then working with a physical therapist that's going to be able to kind of work with you with that specific injury and then give you a rehab program that you can then take to the gym is great. Working with a personal trainer ahead of time who understands your body and is going to make sure that you're doing those workouts properly is great. If you get injured, you come see me. You come for the person who's going to actually be able to diagnose you and tell you exactly what's wrong. And then we can decide, do you only need to do this conservative treatment, or do we have to do something more aggressive? Do we have to do regenerative medicine type things? Do we have to do surgery? How do we get you back to your highest functional level? Because all that matters in sport is function, right? It doesn't matter how pretty your tendon looks. If it's not functional, it's useless. And if it looks bad, but it's functional, it's okay. Brandon's quad is never going to be the same as his quad was before. And that's okay. It's functional. We're good with it.
Yeah. Yeah.
But,
no doubt.
On a cellular level, does it look the same? Probably not. And that's okay.
Not even close.
Yeah, I've seen
my
a lot of
ACL doesn't. Go ahead. Sorry.
a lot of those run labs are really cool. And even further than like gait assessment, they do like VO2 max, they do lactate threshold. You see your heart rate zones. Like you see so much, and there's so much value in both training and injury prevention that it's something I've been really interested in, like going forward. And I think there's just so much value in doing it right the first time. Right. So I've seen like you have your one in New York, there's one in Austin, there's places popping all over the place. And I think there's just so much value, and it applies to more than just running, right? You can assess you can assess movement in any capacity. You have those markers. You're able to see
have force plates.
Right. Like there's so much technology these days that the options are endless, and you just have to be willing to go and seek a professional.
And I think we're trying to get more things covered by insurance. I think trying to get insurance companies to realize how important, like, making sure we stay healthy, how important preventative medicine is, right? Preventative medicine is not sexy in any way, shape, or form, right? There's no like whoop-de. No, we are just about trying to maintain as much health as we can, because people are living longer. We are living much longer than we used to, right? And I think the importance of preventative medicine really comes into it. I mean, Jaden, you mentioned like holistic care. Holistic tends to sound really airy-fairy, but that's truly what it is, right? It's not about like tinctures and potions and stuff like that. It's about, how do I make you the healthiest version of yourself, and how do we do that as early as possible so that we don't have to fix a bunch of injuries down the road. I would love to be out of a job. I would love to just retire tomorrow and go on vacation forever. That's fine with me, right? But I'm here until people need me. But I want to see true health and wellness, and not this, I don't know, kind of weird version of what the wellness industry has kind of become, where people want to drink raw milk and whatever. Like it's not true wellness, you know. I could get on that soapbox too if you want, but I won't. It's not about the food dyes. It's about like, how are we actually taking care of ourselves? Are we getting enough physical activity? Are we eating a balanced diet? Like that's what actually matters.
Yeah. I think it starts with those big rocks. Like, are you exercising? Are you moving? Right. Are you hitting your macros and micros? And then maybe you can start to worry about those other minor things that maybe move the needle 1%.
And whatever. Yeah,
right,
exactly.
Right. Yeah. But just people are trying to get those easy fixes, but they're overlooking the simple things that are way more research backed and prevalent.
Yeah.
So
yes, exactly. Yeah. So we're getting stuck in the weeds a little bit right now. These days. Hopefully we'll get out of them soon.
We'll see. Interesting times. I'd love to hear you more speak on like struggling with authority. I know that was something
I was going to ask.
Yeah.
Open that can, please, Colin.
Yeah. I mean, as
one of the coolest people I've met in that area. So
yeah, I mean, that was one of the reasons I got out of the college world, was as a strength coach. Like, I just struggled with that as well. Just like, I think one of the most important parts of my role was just keeping them healthy, keeping them on the court or the field. And there were times where sport coaches wanted things where I felt like that was impacting my ability to do that. And I struggle with that. And, you know, I controlled what I could and just communicating that as best I could. But at the end of the day, they kind of have the final say, and that was something I really struggled with. So if you want to speak to that, just places you've experienced that and how you dealt with that.
So I am a very outspoken individual in the things that I know stuff about, right? So I'm not just loud for no reason. I'm loud because I have something to say that I think is applicable to the thing that I want to talk about. That being said, I am also a female in a very male-dominated field. And when I was doing my fellowship, for example, at Iowa, I was a very young female in a male-dominated field, working with athletes that were not that much younger than me. I mean, we had a little bit of an age gap, but not that much, right? And so an issue became where my authority would be questioned, I think, partially because of my age and partially because of my gender. And even just how I maybe looked, like if I didn't have the usual like team doctor khakis and, you know, a shirt that was 3 sizes too big on me, and, you know, my hair in a ponytail, like, you know, all of my clothes from my time at Iowa are literally like men's smalls, which were just huge on me. And I was like, are there no women anywhere that do this? Like, can we not get women's sizes?
Preach.
And so a lot of the times it became, what is the balance between speaking out and like respecting kind of, I'm still in training, but I also am the expert at or one of the experts at what I'm trying to speak on. Brandon, I think, knows this happened, but there was a couple of times that the coaches were complaining that the players weren't paying attention to what they had to do because I was on the field, as if like I was trying to flaunt I don't even know, because it was
insane.
It was so stupid to me, because I was like, I'm here just like my co-fellow, which were both men, are here the same. We're wearing actually the exact same freaking outfit. And so, why pick me out, right? It's not like if there was a women's soccer team or a women's, whatever sport, if the male doctor was on the field, are the women paying attention to the male doctor more than the game? No, of course not. Like, that is not what they're there to do. And there are plenty of women in the world. So whether they're looking at me versus some other lady, that's their problem. Like, that has
Right.
nothing to do with my ability to do my job well. And so there was a lot of times where I just felt like I wasn't being given an equal opportunity, and I felt like I had to be even louder because of it. And so then that turned me into the bossy woman or the loud woman or the whatever, instead of the self-assured woman or the, knowledgeable woman or whatever. So it was always these kind of negative connotations. And so the reason why I say like I had trouble with authority is because I feel like when it was my turn to be the authority, I wasn't being listened to. And so why would I respect your authority if you don't respect mine? And so that's gotten a little easier as I've gotten a little bit older, because, I've had more years behind me, so I can be like, well, look, I'm old now. Like, I can prove that I look at all this stuff that I did in the meantime. But early on, it was definitely really hard to kind of figure out where I existed, because I was way younger than the coaches, but older than the athletes. And I was in this weird middle ground. And it was hard to kind of create a name for myself and a place for myself that I just felt like I was floating between two avenues. And, Brandon, you kind of touched on it, but I feel like because I was closer in age to you guys during my training, during my fellowship, it was maybe easier for you to come talk to me than some of the older doctors. And so I ended up being like this conduit too. And I think it created a place where the athletes felt like they could trust me, which is so important to us as the team physicians, right? I need my athletes to trust me so that they know that I have their best interest at heart. But then, to have it come back at me and be like, oh, well, they're being inappropriate, or they're too close, or they're too chummy. And that's not at all what it was. It was simply a mutual respect and, a want to make sure that you could trust me. And I think that is something that I actually do really well with my athletes, is I can help them feel understood and help, take their concerns. And if I don't have the answer, find the answer for them in a way that shows them that I have their best interests at heart. And so to have that kind of denied or questioned was really, really frustrating and really hard, and a difficult thing to kind of deal with.
Yeah. I want to keep the conversation there because I think that's the most important thing. But I think this is something I haven't really discussed much. And again, it's kind of because of seeing you go through that, even though I wasn't focused on that, right? Like as a college athlete, I was, and it was in season. Certainly that was my focus, but that environment was all authority. I think being an athlete at Iowa football at the time, it was hard to think for yourself, right? To have your own thoughts, to feel like you can, I don't know, if you have a different opinion, it wasn't necessarily okay with that conversation wasn't happening, right? That's kind of, it was, here's what we're doing, here's the mission, we're striving towards this goal, and we're all pushing that way. And that was kind of just the conversation that was had. And
Yeah.
there's a lot of individuals and people that I think had more going on. Right. And so that's where, you know, my relationship with you was so much appreciated and was like a light for me kind of at that time when I reflect hindsight, because you made me feel like my opinion was like valued, and that I could have one, right, like at all, and that maybe something I thought was right, and certainly not claiming to be perfect, but that it was just okay to have one at the time, and to talk about things that weren't necessarily just Iowa football in the Iowa football building,
Yeah.
was just, now that I'm past that phase of my life and it's not so much about me trying to become a professional or us trying to win a game, and it's more about like humanness in our experiences and the fullness and everything that life has to offer. It was, I just commend you for fighting that. I'd like to hear more about kind of what you felt, kind of what that experience was like, kind of going through that at Iowa and other places. I think that's one of the biggest reasons I wanted to have you on this podcast, is because, like my wife, who's a strong-minded, fighting for a young professional PA and you know what I mean, and just the different experiences she's had with different patients, or fighting that good fight as well, the same one that you just discussed. Like I think that's really important for us to recognize, to have you on, to continue to open doors for other women that feel the same way, to help men recognize what we can do better, how we can improve, just that entire fight. So I just, thanks for doing that. It's so fun to see where you are now, based off of, where we were in 2016 or whatever.
Yeah.
And it's, yeah, I don't know if you have anything more to share about kind of what you experienced, how you felt, what that did to you. Were there times where you almost stepped out? Like, that's really just,
Yeah.
yeah.
I So I was very lucky that I was raised with very supportive parents that said, okay, you want to do it? Go do it. Fly, kiddo, and I think that's what gave me enough self-esteem to be able to know when I was not the one in the wrong, and enough grace to know that when I was, and how to deal with it. I think the reason I tried to be um, there for you guys as my athletes is because mental health is so important in sports, and as somebody who went through the injury process while I was playing sports, I knew exactly what it felt like, and I think to have that kind of connection with an athlete makes a big difference. And I wanted you to feel, yes, I was your doctor, but also like I could be your friend too. Once I left Iowa, I kept in touch with a number of you guys, right? There's a couple of players that I still to this day keep in touch with. Not everyone, obviously, but a number of them. And now we are colleagues. We're right. I am no longer your doctor. And so, um, you know, I think we are humans first, and humans need connection. And I think as physicians, we're always encouraged these days to rush and hurry through a appointment so we can see as many patients as we can. But on the field, like when somebody needs that support, um, their physical well-being will never be good enough if their mental well-being isn't there too, right? And there's this concept called learned helplessness, where like if something goes wrong one time, you constantly think it's going to always go wrong, and until you can break out of that cycle up here, it doesn't matter that your knees are better or your hips better or whatever injury is better. If this isn't better, it's not going to click. You're never going to play the way you were playing before. And so I thank you for recognizing that, Brendan, because it was important to me, and it's important to the way that I practice medicine. Um, and uh, I don't think I don't think that this is something that's only female or only male. I think there's some doctors that are just good at this and some that are maybe not. And that's true for all providers, right? Doctors, PAs, PTs, whatever you are, right? anybody who takes care of other humans for a living, you have to remember that we are all humans, and the patients have to remember that too. I'm also human,
Yep.
right? Like
Yep.
I have
Yep.
bad days. I
Yep.
have days
Yep.
where I have to end clinic early, and it's not because I'm going on vacation. It's because my kid's sick or something. So
Yep.
that mutual respect is so important. But that was a big thing for me. In terms of, the being a mentor to other women, I never went into medicine necessarily planning for that, but I think I grew up, I guess quasi-sheltered enough that I never thought like, oh, because I'm a girl, I can't do this, or because I'm a woman, I wouldn't be allowed to do this. And so
Yeah.
when I hit that hard stop, and it wasn't, it is not it was a learning experience for me. I was like, oh, this is what it's going to be like when I go into practice. Okay, now I get it. And there was some time where I did question, am I dressing like too I don't even like the word provocatively, because it wasn't like but are my clothes just a little too fitted? Should I wear baggier clothes? Should I have my hair in a
For
ponytail
sure.
only? Should I
Yeah.
never wear makeup? Like, should I
Yeah.
deny parts of myself that are just part of me? And it was kind of one of those times where I had to like think through it, and I didn't have any female physician mentors at the time. All of my mentors at Iowa and even previously at Mayo were all men. And I never thought anything of it because those were my bros. I was a tomboy. That's how we roll. But like, there is some small minutiae in medicine that women have to deal with that are totally different than our male colleagues. And no matter how many times I explain it to people, those microaggressions are going to continue to exist for me compared to my male colleagues. They just are. And so I can either run into them head first, or I can try to educate people on them, right? So, for example, when I have patients come in and I say like, oh, blah, 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 you have this injury, I think we should do this kind of injection. Here's all your options, but this is what I would do if I were you. I think we should do this kind of injection. And they go, oh, well, do you do it? And I go, yes. And I promise you, these are good hands. It will be perfect. And then some of them will chuckle at me, right? They'll chuckle and they'll be like, you're very sure of yourself. I go, well, if I was a man, would I even have to explain that to you? Or would you
Right.
just trust that I would do it?
Yeah.
Right. And some
Yeah.
of them go,
Yeah.
okay, yeah, you should do it. Right. Like it's just calling people out on that little tiny microaggression that they didn't even realize they had. And
Yeah.
inevitably, these are good hands. Like, I'm not
Yeah.
lying, right?
Yeah.
It is, I have honed my skills. I am very good at what I do, and I acknowledge that now. And I have the chops to back that acknowledgement, right? And so I promise good care because I have worked so hard over the last 15 years now to perfect that skill. I've been in practice now 9 years, but I was in residency and fellowship. I mean, it's been like 15 years of post-secondary education. So more than that, actually. God, like 20 years. So I've been in this country for a really long time. So I just think that helping people understand, and then teaching women that kind of come after me to have that same mentality is like, you have to be sure of yourself because nobody's going to be sure of you for you. So get the chops to back it up, and then show people why you're so good at what you do. And you don't have to shove it down their throat, but you have to speak a little louder than some of your male colleagues sometimes. It is what it is. And eventually that will change. And I think for, Brandon, you asked, what can you guys do as men? I think understanding, I think for athletes that have female doctors, understanding that they are the doctor and they are there to do a job, and like, don't even make the comments in the locker room, because in case it gets overheard by a coach, even if you're joking, you know what I mean? In case it gets overheard, then that affects their ability to do their job, right? There was a doctor, I can't remember if it was with the Bills or something, but it was a female physician, and they were like, she's, they can't, she's taking their eyes are wandering to her. And it's just like, is that a her problem or a them problem? Like, who are we having to retrain here?
Yeah.
So I think recognizing that, like, there is a time and place that you can think about somebody's pretty or handsome or whatever, right? Like, when I had a hot doctor taking care of me, I thought, oh yeah, he's really good looking. But like, I didn't say it while I was playing soccer. Like, you do it after. You can acknowledge somebody's, how they make you feel, but like there's a time and place for everything, right? And in the locker room, or in front of your coaches, that is certainly not the time and place. And I think that as colleagues, men just acknowledging that, maybe we do have a little bit more of an uphill battle, but that doesn't mean that we're like some sort of DEI hire or whatever. Like I paid my dues to get here.
Yep.
And so being able to recognize that like I bring maybe a different perspective on how to take care of things, but that doesn't mean my perspective is any less valuable than yours might be.
Yeah.
Yeah.
I'm curious for the women that do want to follow a similar path. What do you think like made you stand out, and what tips would you give them for that process to go down a path that is male dominated, right?
Yeah.
Is it that voice? Is it that confidence? I'm curious what you have for suggestions.
I think in sports in general, you have to be confident, whether you're a man or a woman, right? Like there's a lot of alphas in the sports world, right? We all are alphas. We were all the best players in our high school, and then you go on to college and you're one of the best players in your college. So it's people that are the best at what they do that you're working with. And so when you're working with that kind of population, they expect you to be the best at what you do as well. And so taking the time to really hone your skills, understand your niche, and understand how to relate to your patients. I'd say one of the things I do best for my patients is explain, complex medical terms and make it make sense for them. Because gone are the days of paternalistic medicine where we're like, this is what we're doing. We're cutting this out. We're putting this on. We're doing this and done. Next. That doesn't exist anymore. People want to be involved in their care. And so having this skill set where you can say, well, here's what your options are. Here's why these are your options. And here's what the best one is. And, this is what I would do if I were you, or however you want to say it. I think that skill set is what's going to take, the good physicians from the great physicians. That's what's going to separate you. And so I think for specifically for women who want to go into kind of more male dominated roles, I think, it's important to feel secure in who you are. And so you have to do that inner work first. People talk about imposter syndrome all the time. And then I know just recently, like Alona Mahar came out and said, like, what's imposter syndrome? I don't got that. And it's true. Like, as much as it exists for kind of everyone, it also shouldn't exist, right? There's a difference between imposter syndrome where you do know the answer and you're second guessing yourself, or you do know know what you're talking about and you're second guessing yourself, versus like a Dunning-Kruger effect where people think they know stuff and they don't, and it's just because they have like a weird self-righteousness or something like that. Like, do the work, put in the work, make sure that you really are just awesome at what you do, and then don't be afraid to show it, right? Don't be afraid to show it. You don't have to yell it, but you have to say something, because otherwise you will be looked over potentially, right? It's really easy to kind of be sidestepped. And so I think if you, go through the effort of saying like, hey, this is what I'm really good at, I need you to acknowledge that, because here's all the things that I've done and here's how I can back it up. Like, I'll give you an example. I recently had my meeting with my department chair, and I said, I want to become the director of musculoskeletal ultrasound education. And he's like, oh, why do you think you deserve that? I go, well, here's why. A, B, C, D. I'm teaching all the orthopedic and physiatry residents. Oh, well, thumbs up for me. I'm teaching.
I didn't know it. That's awesome.
I don't know. Thank you. Same, 2 thumbs. But I'm teaching all the residents ultrasound. I'm teaching the fellows ultrasound. I'm teaching my colleagues ultrasound, right? I do some of the most advanced diagnostic and interventional ultrasound procedures. Who else would do it? Who else is going to be better than me? So it's not, why should I do it? I want you to tell me who's going to be better than me, because there isn't anyone, right? So being able to have the info to back up the claim that you're making is important. So what I did all that, and what did I get? I am now the director of musculoskeletal ultrasound education for my department. So, and it was not because it was offered to me. It's because I said, I deserve this, and here's why.
Yep.
Right? Yep. Who knows how long it would have been till it was offered to me. Right?
Yep. Curious, because you just talked about that kind of goal for you. I think you're capable of pretty much anything you set your mind out to. I truly believe that. What are you looking towards, right? Like what's a goal for you, or a couple goals, or what's kind of something you're striving at or really diving into?
So I do want to, I've really I did a lot of grinding in my 30s. I just turned 40 a couple months ago, and I've come to a point where I'm like now considered mid-career in sports medicine. And I think, I lecture nationally, internationally. I love doing that. I love the teaching part of my job. And so, I get to teach my colleagues on how to do ultrasound guided procedures and stuff like that. That's kind of my heavy interest. One thing I do want to do is create a little bit more of a work-life balance now that I have a young child and I'm married, and we want to travel more often. We travel a good amount, but travel and not have to worry so much. So I think part of it will be furthering my career as kind of an expert in my field without doing quite as much clinical work, just so that I can have a little bit more time where I can work from home some days or something like that. The other thing I really love is kind of this, right? So I have a radio show on SiriusXM called the Orthopedic Show, or Orthopedic Channel. We do it every Monday, and that's really fun for me because I get to provide education to the masses, right? And so I think one thing that I'm kind of setting my sights on, and maybe hopefully it's not too late to consider doing this, but I think medical media, kind of like being the Sanjay Gupta of sports medicine, would be a really fun fit for me.
Yes.
Right? Yeah.
I'm tuned in.
I think it'd be so fun.
I ask this question all the time. How do we continue to learn? Right. And it's just like, I would tune into that. I think that would be unbelievable. So
I think it'd be really fun. So I don't know, CNN, ESPN, whoever, sports, whatever, give me a call. Like, let's figure something out. So, but that's kind of where my next interest lies, because I love being able to educate my patients, but in clinics, the way medicine works right now, we only have like 15 to 20 minutes with a patient. It's not enough time. And so to be able to create that education kind of platform for people where they can kind of ask those questions, maybe this could be a way I could do it. And then I do, half clinical, half vet. So that's probably
just
what's
efficiency in teaching, right? Like just,
and make it accessible.
Accessibility and efficiency, and people that didn't even know that they want to learn about that, and now they're diving into it, and then the webbing that can become from that, right? And now I learned this from you, and then I go teach somebody this, and it's like now your impact is all over the world,
exponentially larger. Right?
Exponentially.
I exist in New York. I can't be everywhere, so if patients can't come see me for whatever reason, I want to be able to still be able to reach them.
Yeah, you're traveling to this place for one lecture. How much more efficient could you be if you had the means to broadcast that and ask different topics and all that? Oh my goodness, I wish you success with that. I hope somebody takes you up on that and gives you everything you need to run with that. That would be unbelievable. Yeah,
appreciate it.
I'm curious. Obviously, you're an expert on ultrasound, as you've covered. Are there any other modalities that maybe you're more high on than others, whether that's in the clinic or even outside of the clinic for people to use on their own time?
Yeah. So, I mean, I do diagnostic ultrasound, meaning like the same ultrasound that some OB-GYNs look at babies with. I look at muscles, tendons, nerves, stuff like that. I can even diagnose like a broken bone on ultrasound instead of using an x-ray if we needed to. Like, let's say we're on the field or something, I need to do a quick look. But I also use ultrasound for a lot of procedures, right? So this is different than the ultrasound that they use in like PT offices.
Sure.
I think that things along the lines of regenerative medicine, we're just at the tip of the iceberg with regen med, right? So we have like PRP and bone marrow aspirate stem cells, or multipotent cells, lipogems, which is fat aspirate multipotent cells. So we have a lot kind of coming in terms of like ways to help heal our body. And I think that that's where like a lot of our research is going right now. And so that's some stuff that I'm working on right now. But I think that that's going to be big, and that's something that I'm kind of keeping up with a lot of the topics, is like this orthobiologics, because I think that's going to help our athletic population. The other thing that I think is an awesome rehab modality that I don't think gets enough time is shockwave therapy. So extracorporeal shockwave therapy, it is basically, it looks like this weird little plastic hammer. It pulses at a high frequency. and it uses ultrasound energy to penetrate through the skin to cause microcavitations, or basically break up the damaged cells in damaged tendon tissue. And the reason I like this modality so much is because you can use it while you're still in season. So our athletic population that's like, I got a race next week or 2 weeks or 5 weeks from now, I can't get PRP and be in a walking boot for 2 weeks. This is something that they can get once a week to try to help remodel some of that tissue. I think, Jaden, you're definitely in a great, going to school to become a PT, and that's a great field right now because we are getting so much better with a lot of our rehab protocols in terms of eccentrically loading tendons so that we get that remodeling, so those tenocytes or those little tendon building blocks build faster. And so a lot of the protocols post-surgery, for example, have really encouraged like early range of motion, early loading of tendons to try to help with healing. So I think that's going to be a really exciting place for physical therapy, even in the coming years here.
Yeah, I think it's really cool. I think diagnostic, ultrasound, and shockwave are both growing, even in physical therapy as well. And I think I've seen great things with both of those in my own clinical experiences, and I think it's really good for the patient. Obviously, I'm curious. As far as like day to day, you said you work with a lot of different sports, a lot of different injuries. I'm curious how much that varies on the day to day. Like, are you specific sport, specific day, or is it just all over the place with schedule wise? I'm curious.
No, every
how you
day's an
balance
adventure. Every day's an adventure.
that.
I mean, it depends on depending on the sporting season, right? I might see like more ankle injuries or more throwing injuries when it's baseball season or something like that. So that kind of dictates. But I see a very wide range of athletes. So I see from 5 and up. So I'll see like your little jujitsu or like karate kids, all the way up to like a really active 95-year-old who's still gardening or something like that. Like, I love, again, function. So if somebody's like, I want to be more functional, I want to be a better XYZ thing, I want to be able to, dance with my granddaughter at her wedding, fine, we'll work on that, So my typical population is around like 14 to 45, but I definitely see those extremes, and I think that keeps me on my toes. It guarantees no day is the same. I do have a very heavy procedure clinic. So I do a lot of procedures. So there are some days where I do 15 to 20 procedures in a day, which is a lot. Yeah. But it's awesome. And then I'm a big tendinopathy specialist, obviously, because that's what I talk about a lot. But so I do this procedure. It's called percutaneous ultrasonic tenotomy. So it is basically a microinvasive surgery for chronic tendon injuries. And so I do have 2 days a month where I'm in the OR doing like little micro tendon surgeries, basically, which is awesome. Again, it's better for when people are out of season, right? It's not something where I can get you back playing like within a week. But it's definitive treatment for a chronic tendinopathy that's just not getting better with physical therapy, shockwave, other rehab modalities. Like it's at the end of its kind of road. And so to try to decrease the likelihood of a rupture or something like that, we go in and clean up the tendon tissue so that we can hopefully cause remodeling. So it's fun. Every day's different. Yeah.
Selfishly, I'm curious if you've done any research with peptides. I know that's become more of a
peptides is big right now. Yeah.
Popular, yeah.
Yeah. I have not. I think we're gonna start a project soon. I'm working on like 2 other projects right now. So I don't have the bandwidth for it right now, but I think that we are going to start doing something. We have a sports nutritionist that I think has some interest in it too. So I think we're gonna have probably something coming down the way. It's really funny because a lot of times, sometimes I have patients that come to me and they're like, hey, what do you think about this? And I'm like, I don't know what I think about that yet, because that's a new idea to me, right? And so then that's where the interest gets piqued, and then I start hearing more and more people talking about it, and so it's like, okay, let's look into this a little bit more. So my big thing is looking into like what's the current literature right now. And right now it's, wishy-washy at best, and that's okay because there haven't been these great randomized controlled trials yet. But there are some case studies that show some benefits. So I think for the most part, they are low risk for people. And so I think if people want to try them, it's not a bad idea as long as you are otherwise healthy and everything else looks okay. Will it potentially just give you expensive pee? Sure, maybe. But if that's the worst thing and you're okay with spending the money on it, I think it's fine, right? But I think as the literature continues to change, that's the beauty of science, right? She is ever changing. And so as long as we kind of trust her and do good studies to make sure that we're finding the best data, I think anything's on the table.
That's awesome.
Yeah.
I'm curious obviously you're very busy between having a family and all your roles and like with your injury history, I'm curious how you like to stay active currently, maybe some passions outside of work or just things you like doing to stay active.
Yeah. So my husband and I are both very active individuals. So like I said, post baby, my activity level has certainly gone down a little bit just because I try to spend more time with her too when I'm home. But I love boxing. So that was something that I actually got into Muay Thai initially. And because of my foot injury, it had a hard time with some of the kicks and stuff like that. And so that kind of morphed into boxing. I love it. I love, like I said, I love the power of it and I love the endurance that I get from it. So I actually boxed all the way until like I was 36 weeks pregnant. And
let's go.
I was
awesome.
throwing some, it was pretty
awesome.
I have some videos. It was pretty funny. I was just like,
awesome.
I might give birth here. I don't know, but I'm going to do it. And I still dance. I like to salsa dance a lot. So Latin ballroom. But my husband is not a dancer at all. So that is not a thing that we do together. And then we love hiking. We love hiking because we like to travel so much. So we will go to like the Azores and go hike. We're gonna go out to Park City soon, do some skiing and hiking because I taught him how to ski a couple of years ago, and now he's a pretty good skier actually. So we're gonna go skiing. So we still ski together. I love hiking, and I've recently gotten into like cycling more. Like I wasn't a huge cycler, but like I think it's because it's easy for me to go and get a really quick class in. I think the camaraderie that you get with some of those like Soul Cycle or Cycle Bar or whatever classes, it's actually kind of fun and it's a good way for me to get cardio in that's like quick because I hate cardio. I will go to the gym and lift all day, but like make me run on a treadmill and I want to punch you in the face.
Yeah,
like it is
no
not.
doubt.
I don't. It's
Agreed.
Unless I'm running with a purpose, I don't enjoy it anymore. So soccer, loved it. Running on a treadmill, hate it with all my heart. So I think that's the other way that I like to stay active, and then literally chasing this child around now. Thing. So yeah, we got like a hiking backpack and we take her now. So it's really cute. I don't know. It's changed. It's definitely changed.
Yeah.
Yeah.
I know you have your radio show going on. Anything else you want to plug that you're currently doing or ways people can follow you?
Oh yeah, sure. So yeah, the radio show, like I said, it's on Mondays, Monday evenings from 6 to 8 p.m. Eastern time, channel 110 on Sirius XM. So it's great for a drive home during rush hour. I also have my Instagrams at Dr. J NYC. Doctor, spell out the word DOCTOR J NYC. And then I'm not very active on my Twitter Twitter or my TikTok anymore, but I probably should be again. But my Twitter is at the new Dr. J. And I think just I'm working on a lot of really fun projects for education online. I have a couple of platforms that some of my lectures are being put onto now. So for people in the healthcare field, if you're interested, you could check out OOG. So OOG is a platform for healthcare professionals that is going to go live. They're still in beta testing, but it's going to go live really soon. And I think that'll be a really cool opportunity to like learn from experts in different fields about different cool topics. So that should be pretty fun.
That's awesome.
Thanks.
Any other questions, guys?
No, is there anything that we didn't hit on that
I feel like it was awesome.
It's on your head right now? No,
that's
thank
great.
you so much. Thank you so
Thanks
much
for
coming on. With obviously all the things that you have going on, it means a lot to
No
us
problem.
for you to create time.
Yeah.
And just to just to chat and catch up and share all the things you're working on, and hopefully really empower some people that are listening. So I think people are very lucky to hear from you. I know we're lucky to have you on. So
thank you. I appreciate it. No, it was so fun. And thank you for rescheduling, guys. Sorry again. It's just, life changes. Like I said, I was just like, oh my God. But this was definitely way better. If I was like holding a baby during this, it would have been me. So it's one thing to do a quick phone call. It's another thing to do a podcast. It's just too hard. So appreciate you guys. This is really fun. Thank you, Brandon, for inviting me, and guys, it was great to meet all, the other two of you. Yeah, this is, I love that you're doing this. I think it's really cool. I hope it kills.
Yeah, appreciate it. We'll love to have you back sometime I'm sure you'll dive into some other cool things. So we'll love to
we can talk
sometime.
about whatever. Yeah, hopefully I'll start doing this media thing. I just need to get my ass in gear and like get it. I gotta make a sizzle reel first. I think that's like the first thing to do, and then
there we go.
And then get around to it. But yeah, I'd be happy to come on anytime.
Awesome,
love it.
Okay,
thanks for hopping on. All right, till next time.
Good to see you guys.
Thanks for listening to the show. If you enjoyed today's episode, leave a rating, review, or tell a friend to check us out. Be sure to follow us at SHRP_training for more content to help you be your best self. Go be great today.